Hi guys, my name is Guadalupe Valencia, and for my final project for the PH 100 class, I have decided to do my presentation on the high rates of diabetes in low-income neighborhoods and the high cost of medication associated with diabetes. So for starters, what is diabetes? There is various forms of diabetes, for example, type 1, type 2, gestational diabetes, and pre-diabetes. Type 1 diabetes is when your body is not able to make insulin. I quote, your immune system attacks and destroys the cells in your pancreas that make insulin. Type 1 diabetes is usually diagnosed in children and young adults, although it can appear at any age. People with type 1 diabetes need to take insulin every day to stay alive. Type 2 diabetes is when your body does not make or use insulin well, which is called insulin resistance. You can develop type 2 diabetes at any age, even during childhood. However, this type of diabetes occurs more often in middle-aged and older people. Type 2 is the most common type of diabetes. Gestational diabetes develops in some women when they are pregnant. Most of the time, this type of diabetes goes away after the baby is born. However, if you've had gestational diabetes, you have a greater chance of developing type 2 diabetes later in life. Sometimes diabetes diagnosed during pregnancy is actually type 2 diabetes. For this presentation, we're only going to be focusing on type 1, type 2, and gestational diabetes. Who is most at risk of developing diabetes? Individuals are more likely to develop type 2 diabetes if they are overweight or obese and are the age of 45 or older, have a family history of diabetes, are African American, Alaska Native American Indian, Asian American, Hispanic/Latino, Native American, or Pacific Islander. Throughout the U.S., diabetes prevalence has increased over the past 2 decades, disproportionately affecting low-income populations. Earning less than $15,000 a year doubles a person's risk of developing type 2 diabetes, and people living in poverty are also more likely to suffer from the complication of diabetes. So summing it up means that low-income communities are at a higher chance of developing diabetes. Diabetes data. An estimated 34.2 million people have diabetes, which is 10.5% of the US population. An estimated 7.3 million adults ages 18 years or older have diabetes but are undiagnosed, which is 21.4% of adults with diabetes. Men are more likely to get diabetes, but women are more likely to develop certain complications from it. Data shows that there are about 79,000 people who die from diabetes each year, which with type 2 diabetes accounting for 95% of all cases. Symptoms of diabetes / short-term complications of diabetes. Type 1 diabetes symptoms are increased thirst, frequent urination, hunger, fatigue, blurred vision, weight loss, and tiredness. Type 2 diabetes symptoms are similar: increased thirst, frequent urination, hunger, fatigue, and blurred visions. For gestational diabetes, it could be a mixture of type 1 and type 2 diabetes symptoms, or the person could have no symptoms at all. Usually, a test is done during pregnancy for diagnosis of diabetes. Long-term complications of diabetes 1 and 2. For long-term complications of diabetes 1, there is cardiovascular diseases, skin problems, gum disease, pregnancy problems, retinopathy, which means losing eyesight, kidney damage, poor blood flow, and nerve damage. For long-term complications of diabetes 2, there's eye, kidney, and nerve disease, microvascular problems, which are heart, brain, and blood vessel problems. Major complications from diabetes: wounds in foot that won't heal, leading to amputation, heart disease, damaged blood vessels and retina, which can cause blindness, kidney failure, and strokes. Long-term effects of gestational diabetes. Gestational diabetes can lead to a wide array of long-term cardiovascular health issues. Women with a history of gestational diabetes had increased risk for heart failure, coronary artery disease, and stroke, among other problems, and the risk increased with age. Also, there's a higher chance of developing diabetes type 2 later in life if you had gestational diabetes while you were pregnant. Diabetes be prevented. Type 2 can be prevented with proven achievable lifestyle changes, such as losing a small amount of weight and getting more physically active, even if you're at high risk, can mean the difference between getting type 2 diabetes and not getting it at all. With type 1 diabetes, you can stave off or prevent the short-term and long-term complications of the disease, but type 1 diabetes isn't like type 2 diabetes, which at times can be prevented by taking good care of your body, watching your diet, and staying physically fit and active. Gestational diabetes can be prevented by lifestyle interventions. So the same thing as type 2 diabetes. taking care of your health, watching what you eat, and being sure you're active. Environmental factors. Diabetes has to do with a lot with environmental factors. For example, where you live. Living in low-income neighborhoods doesn't always give you the best choices on healthy food. Usually there's only liquor stores which do not include any healthy food at all. Accessibility of fast food. Many low-income neighborhoods have close by fast food chain restaurants, making it easily accessible for an individual to eat unhealthy. Education. Not being well educated on the subject of diabetes and the symptoms to look out for. And the last one is status in the US. Not being illegal in the state can also determine your chance of developing diabetes, because not having status equals not having medical insurance for a lot of individuals, which equals not attending health checkups. A treatment and medication for diabetes. Depending on what type of diabetes the individual has, is what determines what treatment/medication they receive. For type 1 diabetes, the best medication to control type 1 diabetes is insulin, along with good healthy diet and exercise. For type 2, it's a variety of medications prescribed by a doctor that best fit the patient. High cost of medication. The most recent data from the American Diabetes Association estimates that those who have the disease spend approximately $324 billion a year on healthcare costs associated with diabetes treatments, a national average of $10,877 per patient. In fact, 1 in 7 healthcare dollars spent in the United States goes to diabetes treatment. These high costs are directly related to disproportionately high prescription drug prices in the United States. Patients without health insurance can pay up to $100 per month for a metformin prescription. Multi-drug treatment courses for uninsured type 2 diabetes patients can cost between $200 and $500 per month, or $2,400 to $6,000 each year. Without insurance coverage, a blood glucose meter can cost upwards of $1,150. Lastly, insulin pumps can cost between $4,500 and $6,500 for diabetics without insurance. Why should you care? You should care because it is not fair that individuals from low-income neighborhoods are diagnosed daily with diabetes. You should also care because type 2 diabetes is something that can be prevented by eating healthy and exercising regularly. So us as college students getting a bachelor's in public health, making sure that if our parents know, if our families don't know the symptoms to look out for diabetes, making sure we give them that information. And lastly, because instead of having propositions to keep putting fast food restaurants and liquor stores in low-income neighborhoods, there should be a change to add more supermarkets with fresh vegetables and delis. That was all that I had for my presentation. Thank you for listening and watching.